everyone. Happy November 18th. This is Dr. John Burroughs at Springs Aesthetics, and we're doing our first live Evoke treatment. And we are the first in southern Colorado to have this. This technology is amazing. It uses external radiofrequency heat to contour and tighten the neck. And if you leave it on a significant amount of time with each treatment, you can actually reduce fat, all done in a contactless manner. So the probes that deliver the heat are underneath this chin strap, and it's hooked to the Evoke machine. I'm going to walk past here.
You're good.
That has temperature feedback. So we have it set at 43 degrees. 43 is what you need to get the fat tightening or fat reduction and the skin tightening. And so she's now at 43 degrees, and it tells us that by the yellow color here. How are you feeling so far?
Great.
Yeah.
Very comfortable.
Yeah. So it can feel warm as it first heats up, but as it keeps working, you basically get used to it. So most people only feel the warmth, they don't have any discomfort, and it's very interesting in how it works. Now, we've had an earlier generation of this that some of our followers and clients and patients may have had with the Forma, where you move a device back and forth. But the nice thing about the Evoke is that it takes away any technical error that could take place, and you can just stay in the room by yourself, which is nice, unfortunately, in this COVID era right now, to where you can be in the room, be on your phone, watch TV, have an iPad, and nobody else is in the room, which is comforting for some people these days with the COVID infection going on. Now, the way this works is it tightens and collapses part of the fibroseptal network in the skin, and that thereby develops collagen and improves the elastin into a more organized fashion, which will tighten the skin. Also, as I mentioned just a little bit earlier, when you reach that 43 degrees, you can actually have lipolysis, where some of the fat is going to be destroyed, and then it just gets absorbed, and it'll be gone forever unless you have a large weight gain and the remaining fat can hypertrophy, but we won't go there. Now, if you have a lot of fat in the neck, you're still going to need liposuction. Generally, the liposuction is done right through a little incision right here. Takes 1 or 2 stitches, and you just pull out the fat. But this can be done with it and as part of a maintenance after you've done tightening of the neck, either after surgery or our neck tight and face tight treatments, which we've shown on previous videos, and those are done from the inside of the skin. Those ones you don't need to suture. They go through just little tiny ports, and that will tighten the skin. We've had success with the face tight, neck tight for the areas we've treated as high as 40% or a bit more, and it can last 3 to 4 years. Now, the Evoke, you go through a series of 6 treatments once a week, and then we recommend a maintenance schedule about every 3 to 4 months, where you just do a single treatment. And the nice thing about this is you sit here, you're comfortable, and you'll get nice results, and no shots, no numbing cream, no discomfort, no downtime. It's basically a very straightforward, simple process, and that's what is making this so popular in the locations that are the first to get this technology. And it's unique in the way it works, and there's no other devices out there that does what the InMode Evoke will do. So we're very excited to be bringing it into the practice. As I mentioned just a moment ago, it also is nice after surgery as a maintenance program, either after facelift or neck surgery, to help maintain your results. You come in once a quarter and you get that done, and it will help keep your nice results you've gotten from your surgery. Now, if you don't do surgery and you start with the radiofrequency under the skin, I'm sorry, I forgot my handpiece there, that takes 3 to 6 months to kind of build up to its result, but it can last, like I mentioned, 3 to 4 years. also with that, this will be used in combination as your maintenance once you get to that nice result. Now, we're also, I'm just gonna briefly mention here, the first in Southern Colorado now to have the Morpheus 8, which treats with radio frequency from the outside. So these little pins that come through here deliver energy up to, you know, 8, a little bit more than 8 millimeters. So for areas and patients that have a lot of neck fat or in other body areas like the back of the arms, bat wings, or abdomen, or to tighten like the breast tissue to pull it up some, this is the device you need to have. Other popular areas are going to be above your knees and for cellulite reduction on the back of the thighs and upper buttocks area. But this is amazing technology, and InMode is just doing amazing things where you get great results, but you're not having to have surgery, which is nice. Or if you do it with surgery, it can complement and do aspects that if you did with surgery, it could cause, you know, distortion or unnatural appearances, whereas this, done with surgery, can give you more natural looking results. The other thing about the Morpheus 2 is you can turn up the energy pretty high, and that can also cause lipolysis of unwanted fat, so like the jowls and the neck areas there. Now the 8 is pretty powerful. That's more for the, you know, below the neck areas, but if there's considerable fat in this area, we're going to be using that. In fact, we're doing one tomorrow in that regard. So how are you feeling again?
Very comfortable. I wish I had a TV in front of me right now.
Instead of you know, getting in your personal space and personal time. The treatments are a half hour. If there's more fat that you want to address, you can go 45 minutes. You can also, as I mentioned, treat the lower face, so it can help with jowls and tightening the lower face there, some with the parentheses, nasolabial folds, but this is the chin attachment. So if you're going to do both treatments, you got to do one first and then switch to the other, but it can be done in the same day. You just need to have a greater amount of time allotted for that. So again, after your 6 weeks of those initial treatments, you're going to start really seeing nice results beginning about at the time of the 6-week point, but you're going to start seeing the peak results about 2 months after that. So it is something that keeps building and improving. So, do you have any comments while you're having this done?
Come in on your lunch break and have this done with us.
Yeah, a lunchtime lift.
You can go right back to work.
Yeah. So again, as part of No Neck November, it's 10% off of these procedures, anything that we do for the neck. And so I just wanted to point that out. This is our first live patient. We've done some others, but this is the one that graciously allowed to be videoed for this. So I hope everybody's doing well and staying healthy. And the last thing I wanted to point out is that in this unfortunate COVID pandemic, this is a great procedure to have because we are following guidelines by the health authorities on trying to keep not only our patients healthy, but our staff. So, you know, your temperature gets checked as you come in. We make sure you haven't had recent contact with known COVID or having symptoms that could be consistent with that. As long as that's okay, we bring you back into a room, get you hooked up, do your treatment, and then you can go on your way and have your next one scheduled in a week. We also would clean, of course, the attachments in between each patient, but this is a good way to get aesthetic improvements, unfortunately, during this COVID era. And so we try to always provide not only safety, but also results. And we try to find things that give great results outside of surgery. Although surgery is my passion, there is such a demand from so many right now to get improvements, but to not have the downtime or the more aggressive nature that, you know, surgery can carry. So I think I've covered what I wanted to. Our promotion for No Neck November ends the end of November, but we are going to have some promotional first Evoke treatments through the end of the year, so you just need to call and we can let you know what those are. So everybody stay healthy, have a great day, have a great Thanksgiving, and thank you for your time and listening.